Hi everyone, in this video I will talk about the various specialty nurses you can find at a hospital. This is meant for nursing students or maybe undergraduate students looking to learn more about the nursing profession. I will speak a bit more about their daily tasks and give you an idea of what it is like. A quick disclaimer before we get started. I'm an emergency room nurse. I'm not an expert in every field by any means. However, I do feel like I have a good sense of what it is like on other floors, especially since I send patients up to those floors all the time. Now, obviously, this is not the same for every hospital. There are larger hospitals and smaller ones as well. However, this will hopefully give you a general idea of what other specialties you can choose from to work in as a nurse. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a video every single week. Also, be sure to give this video a thumbs up if you found it useful, as it helps others see the video as well. Alright, so the hospital has many different floors, and each floor is divided into subspecialties. The lowest floor in the building is typically the emergency department, as patients must initially be assessed, diagnosed, and somewhat stabilized before they go upstairs onto a different floor. Think of the emergency department as a floor where you get every kind of patient, and it is the ED's job to sort what their medical needs are and organize proper transfer of care to the appropriate team. It also means that patients sometimes come in with what they think is a major issue, but it turns out it's not. And as a result, you get a lot of people from the general public who get minor treatment as well. Therefore, it is common to see a lot of patients from various diagnoses, and that to me is one of the most interesting things about working in the emergency department. So, moving up from the basement or ground floor is typically the labor and delivery or maternity floor. This is due to the nature of pregnancy being spontaneous and sometimes difficult to identify when deliveries are due. The nurses on the labor and delivery side are specialty trained, and again, this may be different based on the hospital you're working in, but there is typically a labor and delivery section and a postpartum section within the floor. The nurses working on the side of labor and delivery are typically specialty trained, while the ones on the postpartum are not. The L&D nurses go through coaching techniques during labor and are involved in resuscitation of the baby when it is required. In postpartum, it is all about discharge planning and ensuring they are adequately informed about all the necessary information when it comes to postpartum for the mother and the newborn. They provide extensive coaching on breastfeeding and helping the mother identify what to expect. This floor also has the NICU, which is the Neonatal Intensive Care Unit. These units focus on providing treatment to neonates and newborns that require extra support to maintain their life. This job typically requires a specialty training and requires maintaining the hemodynamics of a patient through IV fluids, medication, and constant monitoring of pressures, heart rate, temperature, and oxygenation. From the maternity floor is usually the Pediatric Ward. This ward focuses on providing treatment to children. They have specialized rooms that are modified to provide a welcoming experience for children. The tasks for nurses typically involve that of a medical floor, but has adjustments to suit the needs of a child. A great example of this is oral rehydration therapy for hypovolemic patients, which require treating pediatric patients with fluids to maintain their blood sugar and pressure. The challenge on this floor is maintaining a good relationship with the patients. Children and the parents as for example, children and the parents obviously are very concerned for their child, so it can be difficult managing that. This does not require a specialty nursing training, but subspecialties often do, such as pediatric emergency room or pediatric ICU. After the pediatric floor, there's typically a cardiac floor where patients have conditions which require a nurse to observe their telemetry very closely due to the elevated risk of going into dysrhythmias. This often requires a patient to have telemetry leads along their chest at all times, and the nurse's role is to monitor for signs for any telemetry changes and follow certain protocols as set out by the hospital policy. Patient's condition can range from heart-related condition such as heart failure, myocardial infarction, severely septic patients. Patient ratios are typically 1 RN to 4 patients on those floors. High acuity or ICU units are common floors that are found in major hospitals. These focus on providing treatments to patients that have elevated levels of complexity and acuity in their conditions. Therefore, patient ratios are typically 1 RN to 3 patients, which again have various issues going on. Similarly, an ICU nurse has patient ratios that are even more acute and have ratios no more than 1 RN to 2 patients. These patients require constant interventions and monitoring. Think of high acuity as patients that have multiple different body systems that could be doing poorly, whereas the ICU, you have a system that either has completely failed or cannot be adequately sustained for function. Therefore, your nursing duties are to ensure medications are titrated to ensure life and promote a healthy recovery. Another common floor is the nephrology ward. Nephrology nurses play a key role in diagnosing, assessing, educating, and treating patients who have developed or at a risk of developing kidney-related problems. Typically, tasks of a nephrology nurse includes checking patients' records, vitals before, during, and after dialysis, ensuring that hemodialysis and peritoneal dialysis treatments are administered to patients correctly, and monitoring patients during dialysis treatment to identify any adverse reactions. These nurses have specialty training, but it is not as extensive as the ICU/ER or labor and delivery. Medicine units are also very common in hospitals. These units deal with all sorts of infections and diseases processes that decrease the level of function in patients. That means it could have patients that are not able to cope at home or patients that are very, very septic. They also accept many oncology patients who are in their early stages of their diagnoses. Nurses typically do not have further education, and ratios are typically 1 to 4 or 5 patients. Neurology units are also another very common floor that many hospitals have. This floor deals with various neurological issues from strokes to impact injuries causing neurological changes. There are different levels of acuity on this unit, from patients who have had a stroke and require extra support on tasks of daily living to patients who require immediate interventions from an acute stroke. These acutely ill patients are typically in the neurocritical care unit. After they have the operation, they are continued to be monitored in a neurocritical unit by specialty nurses and eventually get placed on a regular neuro ward. These types of patients require routine neurological assessments frequently, in addition to all other medical related tasks. In the NCCU, there's 1 RN for 2 patients, but on the neuro unit, there is typically 1 RN for every 4 to 5 patients. Palliative units are also very common in hospitals, as many patients require extra care with their new prognosis. This can be devastating and, quite frankly, very sad to work in. However, these units are typically the nicest looking units in the hospital. The tasks often require symptom management of patients to ensure a peaceful passing. It is on these units where you will truly appreciate your health more than any other unit, as you will constantly be exposed to sad and tragic events that have occurred in someone's life. Patient care is typically prioritized, and therefore there is one RN assigned to 3 patients. Mental health units are also in every hospital. These units are patients who have mental illnesses that require further investigation in ensuring and promoting adequate life. Patients here are typically medically cleared from any other conditions and are primarily on the unit for ongoing psychiatric observation. These patients may be at risk to others or themselves and are monitored and evaluated through questionnaires and assessments on a regular basis while being placed on medication which aim to control their symptoms or behaviors. There's typically 1 RN to 4 patients on those floors. So that's a quick summary of the many different options within a hospital. Now, of course, this is not all hospitals, but I thought it was worth mentioning the different units there are and talk about other very common ones. I hope that this video was helpful in providing insight on many different nursing roles you can choose to work in. Stay tuned for more videos on different nursing jobs that are outside the hospital. Thanks for watching, and I'll see you in the next video.